Hello everyone, this is Dr. Divyata Shekhar. We are here from Manipal Group of Hospitals, Yeshwanthpur, to spread awareness on osteoporosis. We have experts from the fields of endocrinology, orthopedics and obstetrics and gynecology to enlighten us on the same. I would like to introduce them. We have Dr. Shankar Kurpad, Senior Consultant, Orthopedics, Dr. Rajeshwari Janakiraman, Senior Consultant, Department of Endocrinology, Dr. Ambuja Govindraj, Senior Consultant, Department of Obstetrics and Gynecology. So I would like to start the session with you. So can you please tell us what is osteoporosis and what are the symptoms? How do we know someone has osteoporosis?
So osteoporosis is, as the word itself implies, a disease of the bone which occurs over a period of time and the bone becomes gradually weaker and weaker. Osteo meaning bone and porosis meaning weaker, therefore weak bones, which gradually occurs over a period of time. Many people argue that osteoporosis isn't a disease itself, but in reality is part of a natural progression of the way our bones age over a period of years. In Kannada, it is very simply called as Tollu Mole Kaile, which basically means the same thing. The bones become hollow and therefore over a period of time become easier to break. So when somebody falls, they sustain fractures or broken bones much easier than if the bone quality were normal. Unfortunately, osteoporosis is a very silent disease. It has practically no symptoms that you can pick up at an early stage. And unfortunately, osteoporosis gets picked up very often because somebody has sustained a fracture, and at that point in time, investigations reveal to us that the bone has broken because the bone is weaker to start off with.
So, Madam, from the endocrinology point of view, can you please tell us, are there any hormones which can cause or hasten the process of osteoporosis, or are there other causes also leading to osteoporosis?
So when we look at osteoporosis, looking at the causes or the risk factors we call for osteoporosis, one is something genetic. That means it may be running in the family, so we can see sometimes the grandparent, grandmother or someone has, especially a bent back or so, humpback, that type of thing, or sustained a fracture with a small, minimal trauma. This is the way they might have. But apart from that, age itself is a risk factor for getting osteoporosis. With increasing age, definitely the bones become weaker. And the other thing is female gender, they are more prone for osteoporosis. Now, coming to your question about whether hormones have any role to play in this, definitely. In menopausal women, osteoporosis develops like over the next 10 years or so. Rapidly, the bones become weaker once the female hormones reduce after menopause. So definitely female hormones are something which support the bone growth or to maintain the growth of the bone. Once that is withdrawn as menopause in women, unlike in men, women have a sharp decline in the hormone, and that predisposes them to get osteoporosis. Apart from this, there are other hormones which may involve, but they are not the commonest ones. Sometimes if there is excess of thyroid hormone in the body, hyperthyroidism, if it is untreated for a long period of time, they can have osteoporosis, it can predispose. There are some steroid hormone, if there is excess, then it can cause. So steroid hormone excess, most of the time we encounter as steroid abuse or long-term steroid for certain diseases, But a lot of time this chronic use is not there when the prescription is there. Most of the time it's steroid abuse for by patient themselves taking for various diseases like joint pains and all that can cause long-term osteoporosis. Rarely we have one of the hormones called parathormone which is in excess. That can cause an imbalance in calcium metabolism in body along with very weak bones, that is osteoporosis. These are the common causes.
Madam, coming to your gynecological point of view, how often do you encounter in your postmenopausal women osteoporosis? How common is it? And have you seen any particular lifestyle in women predisposing them to the same?
Yeah, definitely osteoporosis is more common in the women, as Madam said. It is more common post-menopausally. Actually, the osteoporotic starts from very early age in the women, from the age of 30 years. So, and it depends upon their lifestyle also. And menopausally, definitely postmenopausally, there will be rapid decline in the bone mineral density. And we come across so many patients, as Dr. Shankar told, it is a silent disease. And because many of our women, they don't go from the doctor for this chronic low back aches, and they be feeling, madam, my bones are paining. They come with a specific complaint, low back ache, all those things they come, but they don't go to the doctor to take the treatment because they're not aware of this osteoporosis as such when they come to us. So definitely, and women, our Indian women, most of them are sedentary. Their lifestyle is very sedentary. So it is, if at all they're active and nutritionally also they don't take adequate calcium and vitamin D supplements. So we encounter many patients with very variety of symptoms, low back ache, leg pains, all those things. Then probably we will educate and we will send to the respective doctors for the management.
So, sir, coming back to you. So, are there different types of osteoporosis? And if so, how do we diagnose them?
So, I think Dr. Rajeshwari briefly touched upon it. So, elaborating on that, osteoporosis are essentially of two types, so-called primary osteoporosis and the so-called secondary osteoporosis. So, the primary osteoporosis is the run-of-the-mill, everyday osteoporosis problem that most of us encounter in our day-to-day practices, and in reality, most of us as human beings are likely to face as we grow older. That is a normal, gradual process of the body's bone gradually losing its calcium and mineral content over years, or sometimes, as we like to put it, over decades. The bone weakens over decades. It's not an absolutely rapid process. It is in fact an absolutely slow process, very difficult to pick up in fact. That is classic primary osteoporosis. Now the secondary osteoporosis is what ma'am was referring to, where we have a lot of other reasons for the bone to become poorer in quality rapidly. And that very often has to do with hormonal reasons more than anything else. So, as was already elucidated, the commonest cause of secondary osteoporosis would be steroid use or steroid abuse. Where steroids are being used for a long period of time, that would be the number one issue with regards to secondary osteoporosis. Now, apart from other hormonal causes, steroids, parathyroid hormone, various other reasons from the hormonal perspective, the other leading cause for secondary osteoporosis is because of immobility. That is, people don't move around. So very often, I think this is something that has become very much more visible thanks to the COVID-related restrictions. Elderly people especially were told to be cloistered in their own house. Stay in your house, don't come out, because you have a higher risk of being exposed to COVID. They may not even have been immunized. So when those sort of situations arise, out of fear, they don't step out of the house. Their routine walks have come down to zero. They are eating less. They are eating less healthy food, because if they don't go out to shop and get healthy food, how are they going to cook healthy food? So here comes a situation where, thanks to multiple factors that are brought on by the circumstances in which they are placed into, elderly people suddenly have decreased physical activity, poorer nutrition, and this has then led to a sudden dip in their quality of bone. Obviously, I'm not saying that COVID is a cause of secondary osteoporosis. It is the circumstances by which they have become less mobile, less physically active, and that has resulted in osteoporosis.
So, madam, can you please tell us how do we diagnose osteoporosis?
So obviously when a patient comes with a fracture, most of the time they present like that. So it is with an X-ray they will diagnose, and of course X-ray also may show qualitatively it's a weak bone. And there is a quantitative test for that, that is bone mineral density, where we can measure by amount of bone in a particular density of the bone actually basically. So that is one way. The other thing is sometimes they may present with not a classical fracture, but they will come with, as I say, hunchback, or difficulty. They are unable to eat food properly. They are able to eat only small quantities. They have a pot belly despite being thin. These are some of the other things we see when we as doctors or physicians we should be more keenly observant and see that there may be a very slight bend, in the backbone, which they may not have, actually appreciated. They would have like attributed it to old age itself, in fact. So these signs, when we pick up even before they actually have a fracture, probably we can go and do a bone density and diagnose it prior to a fracture. But already if they have a backbone which is bent, already the spine might have got slightly compressed. For that you don't need much of injury. In fact, lifting a small baby, about 1 year old baby, if you lift, or some weights if they lift at home, that can itself compress the spine and cause. So we can diagnose, of course, fractures with the X-rays. The other thing is the bone mineral density. But if there is a suspicion of any other secondary cause of osteoporosis, then we run the test for various hormones or other things, in the blood, if the blood counts are less, or any other basic disease with the bone itself or the bone marrow diseases. That's how we go to for diagnosing.
Apart from these mentioned factors, madam, are there any other factors based on which you choose candidates to screen for osteoporosis?
Yeah, of course, various different associations and countries have the recommendation for screening for osteoporosis. Screening means they don't come with the symptom, but you feel that these are the people at high risk. Example, postmenopausal, commonly around 10 years from into menopause, definitely. Some people at 55 or 60, they start, some of the countries, they start screening for bone density every 2 years or 3 years, like that. So they can do that. Of course, if there is a high risk, a patient has been having arthritis or asthma for many years, you suspect a steroid abuse, then we can do it whenever it is suspected. Similarly, there are some young people who come with backaches and such things, then definitely that is one thing. One more thing I should highlight here is, as Dr. Shankar said, people have been mostly indoors for the last couple of years. Even otherwise, with indoor jobs, we are all not exposed to sun very much, so our vitamin D's are pretty low. So that is one more thing that can cause, as she said, backaches and all. When we investigate for that, vitamin D may be deficient, you treat it, still, they're not getting better, then definitely bone mineral density will be
the next thing
to do after that.
So, madam, now coming to your gynecological point of view, how does hormone replacement have a role in management of osteoporosis?
So first of all, we don't directly jump to hormone replacement therapy. If at all, she is a postmenopausal lady, and if she has attained menopause naturally, means we just first counsel about the lifestyle changes. Then in some patients, in selected patients, like who have attained like premature menopause before the age of 40 years, or where iatrogenic means medically we had to remove our ovaries because of some disease process. In such cases, probably we will think of hormone replacement therapy, but it also has its own side effects, because estrogen causing more incidences of breast cancer. We educate them, but mainly we educate them about the lifestyle changes, their dietary habits, good intake of calcium in the postmenopausal women, because they have to take about 1.5 grams of calcium per day. Apart from the regular women, they have to at least have 1 gram. And our dietary, if you take from our food content, it could be hardly 500 to 600 milligram. And people have got that habit. If you take that calcium supplements, you will get that kidney stones. They will come with so many complaints. Madam, my is telling not to take. They will not listen to us, rather than they listen to their neighbors. So we first counsel about diet, then the lifestyle, as Madam and Dr. Shankar told about the any weight bearing exercises like walking or jogging or any yoga. All those things we suggest them. If at all they're not, and some amount of, we do all the tests, vitamin D3, calcium, all those things. Then if at all it is deficient, we'll supplement with them. And then still, if at all they're not responding to our treatment, we'll send it to specialists, and then we will consider of hormone replacement therapy, explaining all the consequences of it.
So, can you please highlight on the medical management of osteoporosis?
Yeah, most important for any disease, I would say lifestyle changes. Adequate amount of calcium, vitamin D, and sometimes prevention of osteoporosis, the physical activity is different from patients who already have osteoporosis. In younger age, like prevention, we will say weight bearing exercise is very important. Okay, but however, if they are already into osteoporosis, we know they have had a first-time fracture, or we know the bone density is less, and then we would say to keep their balance, improving balance like the walking or even yoga, these which improve the balance and prevent a fall. That is what. So osteoporosis itself may not have lot of symptoms. It's a silent disease. Whereas if they have a fall, then it is a lot of problem. For example, in a old lady, if they have a hip fracture, then mortality, that is the death within 1 year, is much higher than a person who had a heart attack and died. So the risk of mortality is high because of the consequences like bedridden or infections and so many other things. So prevention of the fall is the most important. So we explain to them, to prevent falls, like when they get up from especially in the falls happen in the bathroom or in the kitchen where the water is there. So we tell them to prevent fall, use proper tiles, anti-skid ones, or some support to get up from the toilet seats. And when they are walking, they should have enough light so that they don't skid and fall. So these are some of the most important things that will prevent a fracture in an osteoporotic person. Already if they have osteoporosis, we want to treat it definitely along with calcium vitamin. There are some medications that are available, non-hormonal medicines also. There are some hormonal medicines if they have more severe form of osteoporosis along with multiple fractures and all. So there are hormonal as well as non-hormonal, and these are not short-term therapies. These therapies are for long-term, like this many years together we have to, because as he said, bone disease develops over many years. So the building of the bone also would take many years to happen. So it may take almost 6, 7 years or 8 years, and we may have to change the therapy based on their follow-up and the response to the treatment.
So sir, coming to yours, is surgery required in patients with osteoporosis? If so, are there any specific surgical techniques which you employ in these patients? Please enlighten us on that.
So one of the biggest challenges with osteoporosis is that the patient usually lands up with the first symptom being a fracture. And that is a situation which is a medical urgency and sometimes an emergency. Because a hip fracture in the elderly is a medical emergency. You want them back on their feet as soon as possible to prevent other problems from worsening. Because the same elderly person may have other medical problems, diabetes, hypertension, cardiac ailments, weak lung, a poorly functioning kidney. All of these things put together, they are continuing to work and move forwards because they are able to be ambulant, walking, attending to their day-to-day activities. The moment the hip fracture happens, all of that stops and their system literally grinds to a halt. So our responsibility is to get them back on their feet as soon as is feasible, in a safe manner. So in hospitals like ours, which focus on a sort of multidisciplinary approach to get these elderly people back on their feet, management of osteoporosis is part of the process, but it is not the thing that occurs on day one. It is something that occurs after the surgery is done, after the patient has been stabilized and is now in a position to listen to the advice that we are going to give, because the advice is not just to the patient, it's also to the caregivers, to the family members. What is the diet that would be beneficial to this elderly person? Because this person may also have pre-existing dietary restrictions. The patient may be on a diabetic diet because they are diabetic. The patient may be on a low salt diet. So for them, you cannot blindly say, go drink milk. It is not so easy. So we have to be careful about it, and that is where a dietitian has an important role to play. Similarly, we get the involvement of other team experts like ma'am here to help us with figuring out what their endocrine situations are, how can we improve their status so that their bodies behave better, and the slide downwards with osteoporosis can be slowed down, or sometimes we are even with the help of modern medication able to improve on the bone quality over a period of time. That may be a slow process, it's an uphill process, but with everybody's help, very importantly patient and family members, there is an improvement which happens over a period of time. Now, getting back to your question about how is surgery different in the osteoporotic patient, there are specific surgical procedures which are devised for managing the poorer bone quality in these patient population, and there are specific instruments and implants which are designed to handle the fact that the bone doesn't have the solid strength that we would expect a younger person's bone to have. So, as an example, the younger person's bone is a lot like teak wood. you can hold it with a device or a screw and it will last there for a lifetime. But the osteoporotic bone is a lot like MDF. You put in a screw, and by the time you walk out of the room, the screw is already willing to shake and fall off. So, just like how there's a lot of furniture made out of MDF, there are specific devices used for that. So, identical to that, when we are dealing with weaker bone quality, there are specific devices which are designed to handle and compensate for the poorer bone quality. Now, obviously, if we are unable to figure out that the person has poorer bone quality, it can result in a situation where the bone may not be satisfactorily held in place. That can happen, and we have to be a little cautious about it.
So now coming to the final part, ma'am, can you tell us, is osteoporosis preventable, and what are the measures you would suggest in a gist?
I wouldn't say it is totally preventable osteoporosis, but we can slow down the process of osteoporosis in some situations. Okay, like for example, menopausal osteoporosis will happen, but we can slow it down. But the prevention is something which is very early in the age, young age itself. We should start with children having a good amount of calcium in their food, vitamin D, and children should play well. Like things like jumping, skipping, hopping. These type of exercises improves the stress, or increases the stress on the bone, forming bone, and so that more and more bone accrual happens at a young age. So usually what happens is our body increases the bone content from especially around adolescence, and it reaches a peak around 20-25 years or so, in females, and men up to maybe 30 years or so. After that, it is going to be a slow downhill decline with a major dip postmenopausal in women. So we have to gain as much as bone accrual in the forming age. So that is where the prevention, all the activities, whatever I said, should happen at that age, so that the peak bone is very high. Then the chances that at menopause, if it is very high, the drop will be about this much. If already it is lower down, the drop will be much more, so that it can easily break. So that is what it should be, a very primordial prevention. With a proper diet, exercise. That is. Currently what happens is most of the children are not playing, they are obese, the type of food they eat is also not high protein, or it's more of fatty food, and more of salt, excess salt in their food, and with the soft drinks and all these things. These are not very good for the bone accrual. So I think managing and prevention should happen at that age group one. Other things are, as I said, some of the hormones, like especially the steroid ones, if it is being abused, that can be prevented. In later age, of course, as Dr. Ambuja said, if the menopause happens early, hormone replacement therapy, there is a role in that. Premature menopause, definitely we give hormone replacement up to the age of around 40-45 years or so. Many of them may stop at the age of 30, the periods. So in them, we have to treat them. It has a role, it has no risks in that situation. But other than that, continuing the hormone therapy for long term is not an option. So in that case, if they develop osteoporosis, then treatment is only available. Okay, but whatever the lifestyle, like diet, exercise, can be continued in later life also, because we know, especially people who these space traveling, we know it can cause osteoporosis because the gravity is less. Similarly, here also, if we don't use walk and mobility is there, osteoporosis can set in at any age. So not just menopause. So we have to be physically active. That's very, very important.
So madam, would you like to add on to that?
Yeah.
Are there any lifestyle changes in women?
Yes. See, all the mothers or women that they come to us, they feel whatever the work, the household work they are doing, they are active. But what I say, that is all sedentary work. Whatever we are doing, we are putting the mixie, we are putting the clothes in the washing machine. That is not giving stress onto our bones. That is very, very important, because women will come, we say, go for a walk, madam, there is time ಇಲ್ಲ madam, ಬೆಳಿಗ್ಗೆಯಿಂದ ಸಾಯಂಕಾಲ ಮನೆಯಲ್ಲಿ ಕೆಲಸ. But whatever that ಕೆಲಸ we are doing, it's absolutely sedentary. So women should take out their time, at least 45 to 50 minutes in a day, just for their sake, for their health sake. And I always tell, if you are healthy, you can take care of all the household members, and they also will be healthy. So they should take out time from the very younger age only. 45 to 50 minutes they should take out, they should go for a walk, or they should go for a dance, or whatever activities that they like. They can start a new sport at the age of means 25 to 30 also. So I always suggest women to take out their time for themselves. Apart, let leave the children, husband, everybody. But if they are healthy, they can take care of the household. The whole household will be healthy. That's what I want to give the message. Women should take out time for, let it be housewives, anybody, they should maintain their health, and that should be their priority. So they should take out time for themselves and invest on their health basically.
And so finally, any way that we can reduce the risk of fractures in elderly?
So the risk of fractures are basically related to two independent things. First is the quality of the bone itself. So just like how youngsters keep falling, but they only occasionally sustain fractures, that is simply because their bone quality is so much better. Also, they have much smarter reflexes. Their reflexes are much better. They can protect their critical joints and bones from sustaining significant injuries. They may tumble and sustain bruises, but that's okay. Those are soft tissue injuries. They are not debilitating. They will not be put out of action. The discussion is very different in the elderly, where they have a higher tendency to fall because they have poorer balances. They have poorer reflexes. So when they are about to fall, or when they feel they are going to slip or trip, if they are not able to arrest their fall, they will fall. That is the problem with the elderly. So basically, as far as fracture prevention goes, we have to look at two separate independent things, in the elderly at least. One is how do we try and improve bone quality, which is what I think our basic discussion today is all about. And the second is how can we reduce the chances of a fall prevention. So fall prevention is a matter of a whole great discussion where we look at various sub-aspects. How do we improve balance? So look at exercises that focus on balance. So yoga, for example, is an Indian school of exercise which is extremely good at trying to promote slow, repetitive movements, promoting balance. Tai Chi is so-called Chinese yoga, whose primary focus is about developing balance. Yes, they focus about balance internally and externally as Tai Chi, but the point is we are discussing now the physical balance aspect. The next is about how do we make the household safer. So installing a grab bar, it's like a big handle with deep bolts into the wall, which you install next to the commode for an elderly person, improves their ability to get up from the commode and reduces the chance of a fall in the bathroom. Improving the lighting, it costs you absolutely nothing to change a bulb and prevent a fall. Using doormats that are going to stick to the floor and not skid, non-skid doormats. You get them at every supermarket nowadays. In fact, you get them on the roadside nowadays. You just have to pick them up and use them. So these sort of very simple things make a difference. Don't leave toys unattended in a household. Most of our households, there is an elderly person and there are small children. So the small children's toys are things that the elderly person occasionally stumbles and falls on. So don't leave toys unattended, remove them. Don't keep changing the location of furniture and avoid low furniture. So low furniture is something that we sometimes are unable to see when we are elderly. So it is important not to have low stools, low seating, things that we are not able to see and perceive and therefore stumble and fall. It is important to have these safety mechanisms put into place into our households. And if there is a take-home message here with regards to fall prevention, I think make our households safer for the senior citizens who may be even occasional visitors. You see, sometimes our households very often are nuclear families, but our senior citizens do visit our house. And when they visit our house, it has to be safe for them. So from that perspective, start working on this in the long-term effort to keep senior citizens safe. So in a nutshell, osteoporosis management is important. Try to improve bone quality. And on the other hand, fall prevention is critically important and probably just as important as improving bone quality.
So I guess that brings us to the end of a very interesting session on osteoporosis. I'm sure there were very good take-home messages, and this session would definitely make a difference in your lives. Thank you.
Thank you.